Northeastern University opens its lab to detect positive cases on campus there. Well, today it's also trying to anticipate how COVID might change again.
Please take whichever lab coat you would like.
Okay. Inside Northeastern University's Life Sciences Testing Center in Burlington. A delivery cart with hundreds of COVID tests from the Boston campus arrives every few hours.
School started, we've been averaging about 5,500 tests per day.
Jared O'Clair directs the lab and designed the process for analyzing each swab from students and staff.
We have an opportunity to understand how the virus travels through our fairly isolated community in a very highly vaccinated population.
According to Northeastern, 98% of students are fully vaccinated and 95% of faculty. But vaccinated or not, anyone who spends more than 1 day a week on campus must agree to weekly testing.
We take each little tube with a swab in it.
White boxes contain the routine tests. The blue box carries swabs from people who say they're feeling sick.
And these machines tell us that if you're a positive or a negative sample. Once we know that, then we take all those positive samples and we store them.
On this day, 16 people test positive. So 16 samples move to this machine where researchers can identify the variant within 4 to 6 hours. O'Clair says the answer is important to his lab, but not necessarily to patients.
Clinically, we treat them the same. There's no specialized treatment for any given variant, right? So it doesn't really make any difference what the variant is. The course of treatment is going to be the same.
The lab's current targets: Delta, Alpha, Beta, and Gamma. The World Health Organization lists them as variants of concern because research shows they may be more contagious, less responsive to treatments, or cause more severe symptoms. But the staff here is also on alert for the next new threat.
Every time a variant enters somebody's body, it's going to mutate. If you're vaccinated, it's going to mutate potentially around that vaccine, right? And we need to really make sure that we're tracking that so that if something's going to mutate around the vaccine, we can react.
So if the sample on the swab doesn't fit the profile for one of the variants already circulating, the lab sets it aside for a more detailed analysis that can take 4 to 6 days.
We do expect other variants to travel here, mu and whatever other Greek letters come after mu. As the number of people who are vaccinated increases, the number of variants will decrease, but that'll never hit zero. So
the search for what's next continues, one swab at a time.
If there's a new variant that pops up, we'll be one of the first people to know.
Well, the Northeastern lab routinely shares its results and sometimes samples with the state. The data also can be used to develop more effective vaccines and even booster shots. I'll keep watching this closely, and of course, anything new develops, we'll let you know here.